Tonight's special segment, Soothing Sinuses, a new procedure to end the misery of sinus infections. It could be the long-awaited middle ground between medication and traditional surgery. Health Beat reporter Sylvia Perez is here with the story. Sylvia.
Ron, it is called Sinuplasty and has doctors and patients talking. There's no cutting, no bleeding, just a tiny balloon and a minimally invasive procedure to help patients breathe better. But this novel approach is so new, there's not a lot of science to prove it will provide lasting relief. Still, some doctors believe it has great potential.
The power of balloons. Sure, they can pump up a party, but this concept of inflating expandable material is also being used as a tool for serious medicine. Angioplasty, where a tiny balloon is used to open up clogged arteries, has been saving lives for years. Now, this balloon technique is being used to clear out clogged sinuses.
Sinuplasty is exciting because it's the first real new development in almost 20 years. Traditionally, the only option we had for patients with chronic sinusitis was either surgery or continued use of medication.
About a year ago, Dr. Michael Friedman at Advocate Illinois Masonic Medical Center started doing sinuplasty surgery. He emphasizes this is not for everyone with sinus problems and seems best suited for patients with milder problems or those hesitant to have more extensive surgery.
We've had great success, but we don't know if this is going to hold up a year from now, 2 years from now, or 10 years from now.
Horrendous headaches, painful pressure. What causes all of this trouble? There are 8 sinus cavities in the skull located at the forehead, between the eyes, behind the nostrils, and at the cheeks. Acute sinusitis can be triggered by viruses or bacteria, which can cause the sinuses to become inflamed. Each infection narrows the sinus's small drainage openings. Traditional surgery involves snaking a thin tube up the nostrils and cutting out the inflamed tissue. With sinuplasty, a balloon instead of a knife is used to stretch that sinus opening so the trouble can drain out. That offers some big benefits.
Less pain, less bleeding, faster recovery, and a more naturally functioning sinus and nasal cavity.
Non-stop sinus infections left 47-year-old Nadine Wazalewski stuffed up and lacking energy. Nadine had sinuplasty and says she's 90% better. She didn't fully grasp the procedure's less traumatizing approach until it was over.
The first thing when I realized there was something different was when I was in the recovery room and the girl next to me was moaning really bad and had a wash rag full of blood. And I had nothing, no pain, no nothing.
There are plenty of sinus specialists who think the Food and Drug Administration was too quick to approve this new technique and the surgical tools involved. They claim the hype is getting ahead of the science, questioning the safety and whether results will last long term. Dr. Friedman is now studying the effectiveness of sinuplasty compared to traditional surgery and antibiotics.
I think the procedure is here to stay. I think it needs to find its place, and we need to find the best patients that will benefit from this. And I think the importance of our studies will help us define those patients that can benefit.
Now, many patients who have sinuplasty are able to resume their normal activities within 24 hours. Again, doctors stress this isn't for everyone. So far, it appears to work best in patients with simple sinus problems. Loyola University Medical Center also offers sinuplasty. Doctors there estimate the procedure is appropriate for only about 5 to 10% of sinus sufferers. The balloon cannot reach all of the sinus cavities, and it cannot be used to treat patients with polyps. But for those it can work for, it's a much easier way to go about doing it.
Sure. Good relief. Okay, Sylvia, thanks. Illinois State Police.